Just because your baby passed the hearing screen in the hospital doesn't mean that hearing loss can't develop down the road. Let's talk about 10 risk factors that you should be aware of. At the end, I'll share with you a little tip on when a repeat hearing screen may want to be reconsidered. First on my list is if you are concerned. If you feel your baby isn't making appropriate sounds, or you feel that there is a delay in development, then definitely checking the hearing is important. I rely on parental concerns because you spot problems first. Second, was there an infection during pregnancy? Rubella used to be the leading cause of hearing loss in babies because of infection during pregnancy. Now it's cytomegalovirus. Also, herpes, syphilis, toxoplasmosis, all of these infections can cause damage to the hearing. Speaking of infections, a more serious infection following birth can be meningitis, which is an infection around the brain. Any infection around the brain can cause hearing loss in a baby. Fourth would be a milder but much more common infection than meningitis, and that would be ear infections. Otitis media, especially if it lasts more than 3 months in your baby, can lead to fluid buildup in that middle ear and to potential hearing loss. This is surprisingly common, and I've seen many children in my office who have had hearing loss because of this. Fifth on the list would be congenital malformations, a poorly formed ear canal or a cleft lip. All of these reasons would lead to potential hearing loss, and I'm sure the specialist you will be seeing will follow this carefully. Sixth, and along the lines of congenital issues, are syndromes. Usher's syndrome, Waardenburg syndrome, and neurofibromatosis are 3 that can lead to hearing loss, and I'm sure there's a host of others. Any syndrome should prompt a discussion with your baby's doctor about the potential for hearing loss. Seventh would be an auditory neuropathy. Examples include Friedreich's ataxia and Charcot-Marie tooth. Eighth, and a bit more common, is high level of bilirubin in your baby. There is no set bilirubin level that will cause hearing loss, but anytime the level gets really high, the hearing should be checked in your baby. Ninth on the list is head trauma. Needless to say, any trauma to the head of a baby cannot be a good thing, which brings up the points that you should never shake your baby, and you have to be careful not to drop your baby. 10th on the list are neurodegenerative disorders, such as Hunter's syndrome. These can lead to hearing loss. There is an 11th reason why you should be concerned about your baby's hearing. That has to do if your baby is hospitalized for any reason during the first month of life. The hospitalization could be for one of the reasons we already talked about, such as high bilirubin or an infection. Also, when in the hospital, your baby may have been given a medication that could be damaging to the hearing, so that's important to consider. Anytime a baby is put into the intensive care unit, this is also a reason why the hearing should be rechecked. If any of these concerns that I listed makes you concerned about your baby's hearing, then definitely a repeat hearing screen should be considered. We love your shares, we love your likes, and we love the fact that you're watching out for your baby.